Hello, this is Dr. Do again. This video is on alphabetic list of problems, still on letter H. Today I'm going to talk about could be very serious but not quite common. Hemophilia is a disease of blood coagulation factors. It's a genetic disease and inherited in the X-linked recessive form. I'm going to talk about the inherited different kind of genetic disease, how to inherit it, either dominant or recessive or X-linked or somatic. But before I talk about that, let me just talk about the emergency situation. Is there any emergency situation associated with this hemophilia? Yes, because it is a lack of coagulation factor, either 8 or 9. So with a tendency of bleeding with minor trauma, probably for our normal people, if you bump somewhere on the knee or the joint or the head, it's okay, probably just a little bruise on the other side. But for those people who had this defective coagulation factors, might become serious internal bleeding, either from a head trauma or the joint. So if that's the case, if you know that you have this kind of genetic disease, then usually these people, since it is genetic, so they will know. And then I need to go to the emergency room. I think your physicians probably, or your genetic counselor already told you if anything happened, trauma or minor or major, need to be checked out, to go to the emergency room or go to a physician to do the image study to identify whether there are serious internal bleeding occurred. So is there any situation that associated with this hemophilia disease that you can manage at home without trauma or without serious damage? I think it's asymptomatic, unless there are some people has the spontaneous bleeding from the nose, but it's not quite common with hemophilia, because if the nose bleeding epistaxis usually occur with a platelet disorder. But for this group of people, because they have the coagulation factor, usually the bleeding from the deep under the skin or deep in the organ or in the cavities. So basically you cannot manage it at home if anything happened associated with this kind of bleeding. Okay, so having talked about that, let's just briefly talk about this, what kind of genetic disease it is. It is X-linked recessive genetic disease. So what is this referring to? This type of inheritance usually occur with the male. Only the male can have the disease, and the carriers are the female. So it's like this: the mother had this gene, X gene. Okay, so X-linked. And if the next generation are the females, have two X's, since it's recessive, so this two X's, the diseased gene is masked under, so without any symptom, not a phenotype is negative, so there's no disease, but this female will become a carrier. On the other hand, for a male, because only one X, one Y in chromosome, so this X will nothing to be masked, so this X will become a phenotype. So that's why this X-linked recessive can only occur in the next generation of male descendants. On the other hand, X-linked dominant can occur in male and female, both. So that's the major difference. So on top of that difference, then there's a probability of the next generation. So that is going detailed. One is a quarter, one is half. So I'm not going to talk about that. That's really up to your genetic counselor or your physician to tell you. But this is just a briefly introduction of this X-linked inheritage, either dominant or recessive. There's another type of genetic inheritage. It's called somatic, domatic, or recessive, which means not associated with the 23rd chromosome, which is determine the gender or the sex chromosome. But other than that, the first 22 pairs of chromosome are the somatic chromosome. So any genetic disease associated with these group of chromosome are called somatic either domestic or recessive, following the same rule. The dominant means as long as this disease, the gene is present and the phenotype will be positive, will be present as disease. Recessive, on the other hand, has to have 2 alleles or 2 genes in order to have the phenotype of the disease. So this is about, so that's why in terms of the probability of next generation disease, one is 50%, the other is 25%. Again, following the same rules for the numbers. I'm not going to talk about details of the probability of phenotypes of next generation, but this is the next generation probability of the phenotype, positive phenotype, present diseased or not, carriers. By the way, for the dominant somatic or X-linked without carrier state, as long as you have the disease, the gene that is going to be the phenotype positive, going to be presented as disease. So this is talking about this hemophilia. I just bring this inheritage, a different type of inherited genetic diseases, and if you already know it. I'm sure for those who had this hemophilia, for example, the family and the patient themselves probably already know, because this is not just one individual, it's along the bloodline. I think if you know it, probably in your European royal families, there is a history of this hemophilia. I think one of the queen from the old time was a carrier, so then passing down along some of the male, but not every male, or some of the male, because it's only quarter, 25%. So some of the male will had this kind of disease. But this is anyway. So this is because in later age, I'm thinking about this hemophilia. It is in the genetics or in the other systems, organs. Always talk about this disease. It's just that's how we know about the genetics and the inheritance, the pattern of inheritance. So I hope actually this video is just for the or for those if you do not know. I'm not sure whether there's any sporadic hemophilia. Probably not. It's only the X-linked. So for those people without knowing that, probably you do not have it. For those if you know it, then just be cautious with any sports, and I'm sure your physician or your genetic counselor already told you in terms of injury, regardless if it's a serious injury or minor injury, has to be checked. Make sure there's no severe consequences or complications. So I'm going to stop here, and I hope that interests you about the genetic disease and the pattern of inheritance. I'm going to stop here. Thank you for watching. I will see you next time.